Here we are. We're doing our first evening recording in a long time. We're recording this evening because I had a little incident this morning.
Did you notice which child of yours it involves?
Of course.
It's always the
Did
same.
you?
It's always the same one.
It's
She's away at
always
college. She comes home for a week and there's an incident.
unbelievable. So it turned out to be a really great story, though, and actually a really nice example of how the world is still a really good place. There's a lot of negativity around, like, oh, society's going to hell, people are terrible. Like, there's a lot of that out there. And today I had a really nice example of how society is still really good and helpful and kind. And I'll share it before we begin. Because first of all, I was so impressed by our community and the way they showed up for this episode. We asked for some anecdotes about perineal tearing, but women just like shared so much great content for this episode. So I was really happy to see that. And then I had this incident with my car, and I thought for certain that my car was done today. Like today would be the last day I would drive my car. I thought something really serious had happened because my car dealer keeps telling me that, watch your transmission, watch your transmission. You're at this mileage and your transmission's going to go out soon. So I have this thought in my head that my transmission on my car is going to go out soon. So Ruby, my middle child, texts me today and says, Mom, suddenly the car just stopped driving. I don't know what happened. It just stopped driving. It won't go. I had to pull over. What do I do? So, I have to go get her and call AAA and get a tow truck to come get the car. And I'm assuming, all right, there it happened. My transmission went out of my car. That's it. My car's done. And I get there and I'm trying to, do my own little diagnosis of the car to figure it out. And I'm trying to open the hood of my car. And
That's
I don't do very
something I
often.
would never do in a million years because I wouldn't know
Well,
what to look for when I
really, you
did
should be
that.
able to open the hood of your car.
I can do that. I accidentally do it on occasion. I'm perfectly good at doing that. I'd be happy if I could identify, anything beyond the engine.
Well, I was having trouble today, and I knew that I hadn't gotten my oil changed in a really long time. I'm like 5,000 miles over my oil change. I'm thinking, oh, shoot, like it's either the transmission or maybe a problem with the oil. So I'm going to look at the oil and check the oil. So this woman comes out of the building and she sees me kind of struggling to get the hood of the car open. And she's an older woman, probably in her mid 70s or something. And she says, Can I help you? And I was like, Oh, no, I'm fine. I can do this. Like, I just want to open. And she's like, Are you sure? Can I please help you? And I'm like, I don't know. I just can't get the latch. And so she comes over and she puts her hand under there and she gets the latch and the hood goes right up. And I'm like, wow, how nice. This, like, a little embarrassed, but this older woman, what a lovely woman, helped me out. So then I'm fiddling around in the car and checking the oil, and the oil's totally fine, by the way, 5,000 miles over, and it's totally fine, plenty of oil and still clean. So it wasn't that. So I'm more convinced now that it's the transmission. And I'm waiting for the tow truck, and some gentleman walks out of the building and says,
Was he handsome?
I mean, he was good, decent looking man. Decent.
I was
Older
sure
man.
that would be part of this story. Okay, what happened
Yeah.
next?
Yeah. He was healthy looking. Healthy looking.
Okay.
And I'm like, oh, no, 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 thank you. I'm just waiting for a tow truck. And he's like, Are you sure? And I'm like, Yeah, the tow truck's coming. And he's like, I'm happy to help. And I'm like, Well, are you a mechanic? And he's like, Well, no, but I work on cars. And I'm like, Well, then get over here. Sure.
This is like the scene from My Cousin Vinny where they're like, Are you a mechanic? She says, No. Well, what experience do you have? She's like, My father was a mechanic. All my brothers are mechanics. My two uncles on my mother's side are mechanics.
Yeah,
I
you're
grew
like,
up working
okay.
in I grew up working in their car shop. She's like,
Okay. So
I've
yeah.
rebuilt engines. Okay, so what did this guy? What did he
So
say?
I'm like, I think it's my transmission. I explained what happened, and he said, Well, have you tried to start it? And I'm like, No, I'm afraid that if it's my transmission and I start it, I'm just gonna like blow it up. And he's like, Well, do you mind if I start it? And I'm like, Sure, go ahead, whatever. He's like, Okay. He gets in my car and he starts it up, and it starts up fine. He's like, Starts fine. He said, Do you mind if I drive it? And I'm
And then
like,
he drove away. You never saw him again. This is the story of the good person, right?
Almost.
Okay.
So he's like, I said, Sure. So he drives away and he's out of sight. And
No.
I'm like, Oh shit, I just gave my car.
Are you kidding? He actually drove out of sight?
He drove out of sight. And I'm like, Oh, there we go. I just let somebody drive off with my car, a stranger with my car. I wonder if he's
Okay.
coming back.
I don't know what happened next. And I'm happy to know that you got your car back because obviously you did. But this would be such a great story if you never saw your car again.
You know,
We
I have a
don't want
history with
that, but
this
it would be
car.
just an unbelievably
I
funny
have a history
story.
with this car of it disappearing on me.
What happened?
And he comes back around and he pulls up, gets out of the car, and he says, your car's totally fine. It's not your transmission. Or he didn't say your car's fine. He said, your transmission is fine. And I'm like, phew, thank God. And he said, it's your alignment. You have an alignment problem. And I was
Oh,
like, oh, that makes sense because like last spring, Ruby slammed the car into the curb and I had popped two tires and I never fixed the alignment. So that makes sense. Okay, phew, it's my alignment. He says, you got to go to my guy Tom around the corner at Ace Tire. And I was like, okay, great. I'm going to ask for Tom. Thank you so much. You're so kind, so helpful. Turns out he's a doctor in the building where I was in the parking lot. And he's like, I got to go back to work now. So nice. So I canceled the tow truck, drove my car to Ace Tire.
why does alignment make a car not run?
The car, that wasn't the issue. The car was running. Just, I
Well,
didn't
Ruby
test
said it
it.
wasn't. Ruby
Yeah,
said it
because
stopped.
she panicked and said it wouldn't drive and it wouldn't drive well. So she just pulled over and stopped and never tried again. And then I never tried.
Oh,
So
oh, communication.
yeah, it goes back to the idea that somebody told me it was my transmission. So it just like all things went to that. The brain just went to like, oh, this is the problem.
That's how beliefs work.
Exactly. It's part of the point of sharing the story. And so I go to Tom at Ace Tire and I explained to him what happened. I said, it's, so I need my alignment fixed. And so he says, do you mind if I drive the car? And I'm like, please drive the car. He drives the car. He comes back, gets out of the car, and he says, problem fixed. I was like, really? Just like that? Problem fixed? And he's like, your car you didn't know it, but your car was in four-wheel drive low. So when the car was in like four-wheel drive, it makes the tires all like kind of lock up if you drive too fast. So Ruby didn't realize she had put the car in four-wheel drive. And so there was literally nothing wrong with the car.
And was Tom handsome?
Tom was handsome, yes. Tom was handsome.
You know what? Now you've named his name and where he works, so he's gonna get a little attention this week.
He might. Anyway, the point of the story, the long story, all comes back to like, I didn't pay a penny for any of this today.
Yeah.
I thought my car was ruined. 3 people just very generously helped me out. Nobody charged me a dime.
Yep.
It totally changed the trajectory of my day. My car would have been towed and at a shop and been down a car and all this stuff. And it was just like, humanity is still really good.
100%.
And the other point of the story is that you don't need to change your oil every 3,000 miles because mine was still beautiful. And I'm 5,000 miles over my oil change. And the third point of the story is beliefs and how literally my brain would not go. I wasn't even rational. I didn't even think to check that, it might have been something so simple as the car had been put into four-wheel drive and I didn't notice. And nobody noticed until Tom drove it.
Well, we've made very clear over the years that we don't give medical advice, but now we've also made clear that we do give car advice. Yes. Don't get your oil changed, says Trisha Ludwig of Down to Birth Show.
That's right.
Everybody,
feel free
don't get your oil changed.
Feel free to delay the oil change.
What problem can that cause for anybody?
Well, eventually you do have to change it.
So Tom is going to hear this and he's going to be so happy until you say, don't get your oil changed. And he's going to be like, wait a minute, I thought this was good for business. Now she's telling everyone not to come get their oil changed. So,
all right.
Give and take.
That was a good story, but it just really made my day,
Yes. There are so many stories in our lives where people really come to the rescue. And those are some of my favorite stories. And I hope everyone listening can remember a time or a day in their life when the same thing happened, because I am sure other people have experienced something similar. So that's beautiful.
Keep believing in the good of humanity because, humanity is good. People are good. Generally, people want to do good and help you.
Absolutely agree.
All right. So should we talk about the perineum now? Or are we just like totally off topic for the night and gonna, talk about engines and fancy cars?
Well, I don't have too much to contribute when it comes to cars. So I think we better go back to the perineum.
Okay.
We did have a lot of responses. I know some women wrote in with whole stories, some wrote in with brief comments, and dozens wrote in with questions. Now, many of the questions were the same. I think I have 40 unique questions, but several of
Wow.
those questions were asked many times. So we have more content than we can provide in the episode. Oh, I almost forgot to mention, and I bet you did too. The most common question we had, whether women have had one baby already or two and tore or had an episiotomy, or whether they haven't had a baby yet, can I prevent tearing? Is it preventable? Is it genetic? What can I do about it? We did a whole workshop on Patreon. I wish everyone would understand the value of joining our Patreon, even just for a month or two, and having access to about 50-hour-long workshops where we go deep on content. I mean, these are educational. There's not like this other part where we're like sharing people's stories and we're chit-chatting. This is a full workshop on preventing tearing. So you just have to go to patreon.com/downtobirthshow. Just see what's in there. And if you want to stick around, you can participate in our ongoing workshops all the time, but you can just go in and access this whole library. And did we make that one workshop downloadable in the shop? You can also go there and click the word shop and just buy a single workshop, but it's far better value to join for a month or two.
Yeah, just join and binge. Just like it's all there.
Yeah,
Everything you need to know.
It really is. It really is fulfilling for us to do the work, knowing that women are benefiting. And obviously, this is our work, but we want this to be so accessible for absolutely everyone to partake in. So please partake. I mean, I don't think there's anywhere else to get this information. So we've done all the research on dozens and dozens of topics, including this one. So to prevent tearing, go consume an hour-long workshop on this. There are tons and tons of things in there. So anyway, we are going to talk on a broader level about it tonight. And I didn't know how you wanted to begin. Should we start with anything in particular, do you think?
I think we should just kind of give the background on what tearing is, what it actually means, and then we'll go into people's questions and stories.
Yeah, please also define first, second, third, fourth.
Right. Okay. So when we're talking about tearing, we're talking about the skin between the vaginal opening and the rectum. That is your perineum, and that is the tissue that needs to stretch during birth to help the baby get out, and sometimes it tears. It's actually really common to have first-degree tears and even second-degree tears, and we're really not too worried about those. It's really what we want to do is prevent the third and fourth-degree tear. So a first-degree tear is, it's just like a nick, basically. A second-degree tear is actually tearing into the muscle. And a third-degree tear is tearing deeply into the muscle and to the rectum, whereas a fourth-degree tear is actually tearing into the rectal sphincter. So that is obviously the most severe type of tear. And what we really want to prevent is those third and fourth degree tears because the recovery is difficult. The long-term health consequences are more significant. I mean, ideally, we're preventing second-degree tears too. First-degree tears are just they're going to happen. Don't even worry about that. Don't even think about that. Like you're going to have a little skid mark, we call them in the birthing world, when you give birth.
All these questions around whether they're preventable, they are largely preventable. It would be irresponsible for anyone to say they're wholly preventable because the baby's position alone can be something that will cause tearing. Your epidermis health, your nutrition. I mean, in that workshop, we get into all of the things that do affect whether a woman tears and recovery and all of that. What I do want to convey, though, that I think is so compelling is that May Gaskin published her tearing statistics after she had over 2,000 clients give birth at the farm. I think I remember them all off the top of my head, believe it or not. I guess everyone will believe that with me and numbers. But I just want to tell everyone what her numbers were that she published in her book. I believe it was Ina May's Guide to Childbirth, where she has this published in an appendix. And I want everyone to understand, in the hands of a skilled provider, how very much less likely tearing is. I believe it was 69.5% of women didn't tear at all. 19.1% had a first-degree tear. So that's like already 90% of women who basically have no tearing. Then it was about 9.5% who had a second degree. And then it was 0.3% and 0.1% who had a third and fourth degree tear. So 0.1% is 1 per 1,000 women. 0.3% is 3 per 1,000. So as Trisha said, those are the ones we're really looking to avoid because they're the ones that are so difficult, problematic, and all that. And an episiotomy makes those tears more likely, not less. But I just wanted to say off the bat for the women who are really afraid of tearing that there is so much to do that can prevent them. And some women even ask, does every woman tear? Does it just happen? The answer is absolutely not. So now we can get into the rest of it if you'd like, Trisha. But I just wanted everyone to not worry that much about it, that there really are so many things we can do to prevent it.
Yeah, and I want to also just add to that the INMA statistics are similar to larger studies that have been done on home birth. So this does indicate that the birth setting makes a really big difference in the severity of the tear. Mm-hmm. So, and that's not just because, well, we'll talk about why that is. It's because of a lot of things that a woman can do, as you said. And the goal is not to prevent 100% of tears. The goal is to reduce the chance of a severe tear and prevent long-term health consequences and pain, difficult recovery from that.
Okay. So why don't we begin with me just sharing very quick anecdotes. There's not going to be much to respond to here, so I just want to get them out of the way quickly. The women who didn't tear, some of the reasons they feel they didn't tear. Now, you and I know there's a lot that goes into why women don't tear. That's all part of that workshop we did, but I still think it's worth sharing some of these things that women said about their experiences. I surrendered and accepted the pressure of crowning. I didn't rush it, and I had no tearing. That's a big component of it. How you push, how you breathe is a component of reducing or preventing tearing. Another says, I birthed side lying and I had no tearing. Another says, I birthed on hands and knees in water and had no tearing. In fact, many women shared stories of their water births, and only one water birthed and did tear, and all the others who wrote in really credited water birthing without tearing. My midwife suggested I feel the baby's head as I push, and I didn't tear. I highly recommend. So that woman, what do you say to that one? I want to know.
I think
why is there a correlation?
That might be the number one thing you can do to help reduce tearing is to actually feel your baby's head as it's coming out.
Why? How?
Because it gives you instant feedback on what's happening, and it takes away a lot of the sort of panic that sometimes women feel when they feel their baby crowning, that intense burning sensation known as the ring of fire, which not everybody feels, but many, many do. And the desire to kind of just get past that as quickly as possible. When you feel your baby's head, it just brings you this sense of connection and calm and reduces that kind of worry that I need to hurry up and get this baby out. You just feel a little bit more in control, and there's more feedback going into your own brain.
Okay, the others on this list said, I didn't tear, I birthed in water, my midwife didn't rush me, and my labor was 6 hours in all. Another says, I was so terrified of tearing, and I didn't tear at all with my 10-pound, 4-ounce baby, firstborn baby in water. And then another says, I did perineal massage. Several women said this, actually. I did perineal massage, both pregnancies, home births, no tearing. Babies were 9 and 10 pounds. So she credits it with perineal massage, which I know is a bit controversial, and we discussed that. And perineal massage with, what is this, myrrh oil? For weeks before birth, no tearing 3 times. Myrrh oil?
Okay.
That really?
It could, I mean, people report using different kinds of oils.
Yes,
coconut
I know,
oil,
like olive
oil,
coconut, yeah.
Apricot oil.
Oh.
Okay. Castor oil even.
Yep.
So yeah, the research on prenatal perineal is a little bit mixed. So doing massage on your perineum in late pregnancy, some have demonstrated it reduces tear and some have shown no difference. So the one thing that we have said about that, if a woman does want to do that, go for it. The thing that might be helpful about it is that it does give you a little bit of a comfort level with feeling some of that stretching sensation that you are going to feel in labor, and getting more relaxed and comfortable with that.
Okay. And then we had a group of women who said they had moderate tearing, a woman who had 2 home births and 2 second-degree tears, and she wrote, I don't really see it as a problem. I thought that was an interesting addition there. I had a second-degree tear because my daughter was born with her hand up against her face, and obviously makes the crowning a little more complex with the hand and knuckles there.
Absolutely. If you have a nuchal
elbow,
if you have a nuchal hand, or a hand at the face or a hand over the head, any of those things are going to increase the risk of tearing. That's just positional, and that's because they're putting very uneven pressure on the perineum?
I pushed too early and should have waited. I ended up with a second-degree tear. So again, there's another little testimony about the importance of not pushing too aggressively, which women do because they just can't wait to get the baby out, experience the relief. I had two first-degree tears. Again, that's kind of a non-issue. 2 births apart, 2 years apart, 2 births, 2 years apart. And I want to know if I'll fully reheal. How can someone who's had two first-degree tears wonder about fully rehealing? That doesn't even make sense, does it? Oh, they stitched her. Yeah.
So she may have been stitched not
Yes.
well.
Yes. And that's the problem.
And truthfully, a first degree tear probably almost never needs to be stitched.
For sure. I had an episiotomy with my first, and for my next two babies, I had minor tears at the site. So there you go. I guess where the skin was
Meaning that
compromised.
she tore beyond the episiotomy, which is really common.
I think she said at the site. I think she means right at the point of the weakest, where the scar tissue is. I think she means
in her subsequent birth, she
Yes.
tore where she had the episiotomy.
Yes.
Yes, common.
And then I did perineal massage 3 times a week for 7 weeks, and I had just a 1.5-degree tear. I'd love to know who assessed that with a posterior baby. I know. Those were the moderate tears.
Okay.
General observations and concerns that came in. One woman wrote, I tore with all 4 babies because no doctor told me how to slow down. Another one, actually, this was the first one, but many came in that said, no one is talking about labial tears. So we need to talk about labial tears. Many women reported having labial tears. I want you to explain what it is and all that. Let me just finish this list. I'm worried about the scar tissue from my first and that it will not stretch I will tear again. Okay, I want you to comment on that too, actually. Midwife here, eat a healthy diet, stay hydrated, ease the baby's head out, and don't let providers cause tearing because they are, quote, making room for the baby's head. Great comment. Very grateful to her for that. What do you say to the woman who said, I'm worried the scar from my first will not stretch and I'll tear again? That's an interesting concern. What do you say to that?
The scar tissue really shouldn't be so thick. So some people do have sort of abnormal scarring where they build up more keratin in the skin and their scars are thicker and less stretchy, but that is also not the norm. Most of the time, if you are going to tear again, it usually is right over the scar line. Like that is the point where it tears. So she could do a little bit of scar massage therapy there, using some oils and things to help break down any extra scar tissue and just kind of soften the area. Maybe a little pelvic floor therapy would help too. You could do some internal work to just soften and loosen things there. But I would also really try not to focus on that. The idea is just to focus on the physiology of birth and do your best to not do things that are going to increase your risk of tearing, which we're going to talk about, and let the body do the rest.
Right. It's very common for women to tear in one birth and never in her others. And for her to tear the first time and not ever again. So I think it's a reasonable concern. I can see imagining the same concern if I had torn. But I think that you're right. It absolutely doesn't indicate that she'll tear again.
It definitely does not.
And all the concerns about labial tears. Can you talk about what a labial tear is and then how they happen? Some women wrote in with specific questions like, how can it tear upward? And I'm so scared about that. So can you talk about that?
Yeah, so a labial tear is literally just a tear not in the perineal tissue, but in the labial tissue. So it's just different tissue that's being stretched. So the most pressure, the maximum stretch and pressure is put on that perineum, the base of the vaginal opening, the bottom part, because that's where the back of the head of the baby's coming through. That gets the maximum stretch. But you're also stretching, your vaginal opening is like it's like a diamond a little bit. Like at the top has to stretch and the bottom has to stretch. And the top can stretch and sometimes stretch so much that that skin splits. So a labial tear is usually just like a split in the skin. They are often not repaired because they're usually pretty minor, but sometimes they do need to be. And the same stuff that we're going to talk about preventing perineal tearing is the same stuff that you do to try to prevent labial tearing.
Okay, good. Yeah, we did have 3 or 4 women write
Now,
about it. One asked, but the others had experiences.
minor tears of the labia are common, just like
Okay.
first-degree tears of the perineum are super common.
Okay.
But severe tears, very uncommon.
Speaking of severe tears, here are some of the comments regarding severe complications or tears. I had a 3rd-degree tear, and the doctor said I qualify for a C. Oh wow! Look at that! I've got news for you. You qualify for a C-section. It's your lucky day. All right. So sorry about the sarcasm. We hear this all the
You
time.
qualify.
The doctor found an
Qualify.
opportunity to insist on a C-section. I qualify for one. What
That is
on
a
earth?
ridiculous description.
Ridiculous terminology. I had a third, and it was a 3rd degree. I had a 3rd-degree tear, and the doctor said I qualify for a C-section next time around. But she asks, but wouldn't that be worse? Well, that's
It's
risky.
a much bigger
Sure.
cut.
It's a bigger cut. It's a much riskier procedure for you and the baby. You don't want to do it unless it's absolutely necessary.
Yes.
I can't believe that. That's unbelievable. Okay, next one. I had a 3rd-degree tear and a delayed hemorrhage after the OB missed a stitch. So
Missed a stitch.
well, a
Okay.
3rd-degree, there's some internal tearing. So the doctor missed something, and I guess it caused bleeding. Now, would that still be considered hemorrhage if the blood isn't coming from the uterus?
Yes, you can still have a hemorrhage from lacerations. Yes.
Wow. Wow. Interesting. I did not know that. I had an episiotomy, and the healing was hell, harder than my C-section recovery. See, this is the thing about tearing. Well, episiotomy. An episiotomy is not a tear. It's intentional damage. It's a cut. It's not the tissue just responding to pressure. It's damage caused by the doctor. I mean, it is, no matter even in the very rare instances when they could be beneficial. I mean, extraordinarily rare. I have to be very careful about even implying that it's generally okay to do them, because it is generally not okay to do them. But you usually hear about the problem not being with a tear itself. It's always the recovering, how they stitch. This is so common for women to say episiotomy and healing is much harder
Because
than
when
birth.
you have an episiotomy, you are more likely to have a severe tear beyond the episiotomy. So
Yeah.
you get an episiotomy that's just, a little snip. Well, that little snip can easily become a 3rd or 4th degree tear. And that is the problem. And the recovery with a 3rd or 4th degree is very difficult.
Next, for my first baby in the hospital, I had a 2nd-degree tear, stitched, and it caused too much scar tissue, which led to painful sex. That is not uncommon, and needed to be cauterized.
Yeah.
But with my next 2 babies, I let my 2nd-degree tears heal naturally and had no issues with healing and no pain whatsoever with sex.
So it was pretty uncommon in the days that I was training to be a midwife to ever let any tear be unstitched. It's much more common now, and rightfully so, because so many women have poor results from the stitching, where the tissues are actually not brought back together smoothly enough. And so sometimes the inside tissue can be left outside, right? The outside is supposed to be your skin tissue and only your skin tissue. If any of your internal tissue is sewn up so that it is facing the outside, not the skin protective layer, that will not heal. It will never become skin. And that can be really painful and really uncomfortable. And that's usually when they have to use something on it to kind of like change the tissue texture. They cauterize it basically, or re-stitch.
I didn't know that was possible. This makes me really upset, because it's not the first time we've learned about this since starting our podcast. Doctors are just not trained in doing a good job on any kind of procedure or surgery around the vagina. Like, it just gets me so upset that it's not taken so much more seriously how to restore a woman to her original condition.
Well, this is one of the reasons.
Reckless.
This is one of the reasons they prefer to do episiotomies, because they believe it's cleaner and easier to sew back together, whereas a tear is more jagged and that's harder to align. And
I don't buy it.
What we have learned is that the perineum, the vaginal tissue, is extremely good at healing itself. It's just like your mouth, inside your mouth. You know how things in your mouth just heal really quickly and well.
Because of increased blood flow. There's so much blood flow. But I'm just saying they should do a better job recovering. And if they do an episiotomy, their excuse is it's easier to stitch, but it's not, because there's more likely to be a third or fourth degree tear. But they should learn how to do this kind of surgery, just like they have to learn how to do C-sections. This is so unacceptable that they do such a shoddy job at this. Okay, and the last one, speaking of infuriating techniques and lack of experience and lack of ethics, this one gets the blood boiling. It really does. This final comment is from a woman who said, "What should I do if they gave me a quote extra stitch? I didn't ask for one, and now I slightly tear every time we have sex." You should sue.
That is unbelievable.
It's an outrage. I mean,
Yes,
if anyone doesn't know what this
disgusting.
is, it's disgusting. It's a completely disgusting thing, doctors. I mean, honestly, these must be.
They call it the husband stitch.
This must be, honestly, these must be men. These must be men who are inherently violent. These cannot be normal men who love women. This can't be normal that a doctor would give a woman, quote, an extra stitch, intentionally make her vagina smaller without her permission, and wink, wink to the husbands. And husbands have been told this. "Oh, I gave her an extra stitch." How dare you?
Those husbands should be punching him in the face.
They should be sued. I mean, not to mention, that would be horrible for sex, because the opening is now tighter, but the inside, her vagina, is no different. So now any passage through the opening would be, as this woman is experiencing, tearing. I mean, I hope
it really doesn't actually work.
It's not work. It's not even a consideration if it works. This is complete abuse. This is absolute. This should be such high grounds for a lawsuit. I would hope what these women can do, in addition to suing whoever does this to them, this unbelievable abuse, I hope they can go get it removed, even if they have to be open and bleeding again and just heal again, because to live like this the rest of your life because someone damaged you like this, I hope there's something these women can do.
Yeah, it's horrible.
It just is an outrage. I can't even believe that. The audacity to modify someone's body, and for such a reason, and without consent.
I mean, it's hard for me to even believe that that's actually still done.
Oh, but we hear about it.
I know it's done. It's just really hard to believe.
All right, well, let's get into some of the questions. I know we covered a bit of ground, but let's try to answer some of these questions with topics I think we didn't quite address yet. Is it normal for the midwife or OB to take forever to examine if the tear needs to be stitched?
No.
That's not normal?
Not to take forever, no. No. They should be able to pretty quickly make an assessment on that and make that determination. And what I wanted to say that I forgot to say earlier when you were talking is that, the stitching part for a lot of women is, they report that as being the worst part of their birth, or the most painful part of their birth. So we really, if there's question about whether you should be stitched or not, the answer should probably be no, thank you.
If you tear upwards toward the clitoris and urethra, how do they fix it?
Oftentimes it's just fixing itself. If it's severe, they may have to put a stitch.
How many women end up needing their tears to be re-repaired?
You should not have to have your tear re-repaired. I don't know what the statistic is on that, but a lot of times pelvic floor therapy can help with that, or even the use of estrogen cream can help with healing that is taking longer than usual.
Similarly, I feel like they stitched me up badly. Is that possible? And what should I do?
Yes, that's possible. And pelvic floor therapy and estrogen cream, and possibly needing the tissue treated by a midwife or an OB. What we were describing before was sort of that agranulation tissue and the need for silver nitrate on the tissue.
Tricia, if her birth was only a week or two earlier, is it not too late to just go back to the hospital and potentially, before it's fully healed and there's all scar tissue, is it possible to maybe redo it before it's too late?
She's already been stitched?
Yeah, I mean, if she's a few days after giving birth and she just feels like they didn't quite do it right or something seems off, do you think she should maybe go back while it's
I don't think, unless there's something grossly abnormal, I don't think that that's probably the best course of action. I think you want to give it time to heal. She's only a few days out. You can't really tell if it's, unless there's some gross anomaly with it.
Yeah, just the idea of them doing a bad job and then everything, sealing in place the way they do it. It just, the thought is, just such an uncomfortable thought. I'm just desperately thinking, like, what could you do before it gets to that point, if that's the case for anyone? Okay. Should a midwife or surgeon treat third or fourth degree tears? I mean, only a surgeon, right?
That is generally the job of an OB. Midwives are not typically trained to repair third or fourth degree tears, although some may be.
Okay. And when is letting a tear heal without stitches optimal? I know you often talk about like even most second degree tears, natural tears are, we talk about this in the workshop. You talk about like how to heal optimally. You keep your legs together, don't climb on stairs. There's a whole thing about doing it responsibly. But when you're assessing a woman, if you're with a midwife you trust and she doesn't want to do anything unnecessarily, what are you looking for, Trisha? How would you assess whether she could maybe go without stitches?
You're sort of looking at how easily the skin aligns. So if you can kind of just put it back together really easily and it touches in all the right places, then if a woman is resting properly after birth and kind of keeping her legs together and not doing a lot of stairs or carrying of other children and allowing her body to heal, then that skin is naturally going to heal correctly. But if it is really out of alignment, then you might need to use the stitch to sort of put it back in alignment so it heals properly.
Okay. And the final question is how to control pushing when the fetal ejection reflex takes over.
Well, the fetal ejection reflex is going to do what it's going to do. You can't really control that, but you can use a different style of breath as the baby is coming out that may slow it down. So a little bit, if the baby is, I mean, if the baby just gets shot out, which sometimes happens, like, what are you going to do? You can use your hand to try to slow it down a little bit, but it just kind of happens and it happens. What's going to happen is going to happen. But if the overwhelming sensation to push feels like too much at the moment of the baby crowning, you can use sort of a panting style of breath to try to not like hold and bear down. It's sometimes at that moment women actually do hold their breath spontaneously, very different than holding your breath with somebody's direction. So if you spontaneously feel the urge to hold your breath and bear down, you work with that. But if you are using sort of like a panting style breath as your baby is coming out, then that can slow the descent of the baby. So you're not using as much force.
And there is one more, and I looked up the research on this today just so that we could give a response. I don't love the question to begin with. I don't love that anyone is thinking this way. Nothing personal against the woman who submitted it because I would think this way. But she asked, are older women more likely to tear? I don't like it because I was just talking to a group of my clients about that, about this topic this week. Again, we are looking at statistics to apply to an individual. So what if women your age are more likely to tear is what I want to say. It doesn't have anything to do with you. But I looked up the research on this and it was kind of interesting. I didn't get into which studies were high quality versus low quality, so I have no comments on that. And that's one of the most important things to consider. However, of the research out there, there were a couple of studies that showed, quote, older women were more likely to tear. One showed 16% more likely, one showed almost twice as likely. Then there was a study that showed younger women are more likely to tear. Then there was one that said we see no difference at all. So just let it go because there are so many ways to prevent tearing. Just focus on the things you can control and don't worry about the things totally out of your control, like your age.
Right. So the theory there might be lack of collagen in the skin, the tissue being more friable. And then with the younger person, it might be, well, they have tighter pelvic floors, and sometimes that's been associated with more tearing. So the thing is, also your skin integrity is genetic.
And largely based on diet and
Very
hydration.
much. Yes,
Yes.
absolutely. One thing we know for certain is that women who are not well nourished are more likely to tear. That doesn't mean your diet has to be perfect, though. Let's
Right.
not get like crazy about
That's
this.
right.
This is like we're talking about sort of malnourished versus well nourished.
Right.
And some amount of this is out of our control. If you have a really fast birth, a really strong fetal ejection reflex, you might tear a little. It's okay. Your baby came out quickly. Like, it's okay. So we have to not get too hung up on it. We have to control the things that we can control, which we know are where you give birth, how you give birth, the position you give birth in, using spontaneous pushing and not controlled pushing and bearing down, touching your baby's head, Giving the perineum time to stretch when your baby's head, when you feel that ring of fire, using a different style of breathing and relaxation, that panting breathing, or even horse lips, just sort of blowing out your breath to let that tissue stretch, touching your baby's head to help as your baby crowns, staying off your back. Giving birth in the water is helpful, and using warm compresses is actually evidence-based to be helpful. So that has been studied and shown to be helpful. If you feel like you want somebody, using some warmth on the perineum, that can be helpful. You don't have to, it's just an option.
The main thing is don't have fear. As always, focus on what you can control, relinquish to what's out of your control. And there is even so much to know about how to heal optimally, how to heal better than in other situations. So again, just put your focus on the things you can control on. Check out that workshop of ours. There's an abundance of information there. And as always, you can reach out to us with any follow-up questions after you view it.
And go back to the story at the beginning of the episode about beliefs and how our beliefs can get us set on the wrong path if we get something fixed in our head that this is what something is or means or is going to happen. So
yes, there are handsome mechanics and helpers everywhere.